This is a contrast CT scan of an 85 years old female patient. She presented with cough, extreme weakness, and weight loss. Now, this is a mass lesion which has involved the apical and anterior and posterior segments of right upper lobe. First, I will show you the general morphology of the mass and the lungs, and then I will focus upon the other pathologies. I go back up again. Nodulostriate lesions are present in both the apices. These are suggestive of the previous Cox infection. Now this is the mass lesion here. This has involved the apical and anterior and posterior segments of right upper lobe. This has irregular outlines, shows non-homogeneous enhancement. Anterolaterally, it lies in contact with the respective chest walls. There is no infiltration of the chest wall. Medially, the mass has infiltrated mediastinum and it comes to lie along the right lateral surface of the trachea. Here, there is no involvement of superior vena cava. This is the superior vena cava here. This runs short of the right hilum. Now, please see that these are the calcified pleural plaques along the left lateral chest wall as well as along the posterior chest wall. Now, these represent residual effects of previous pleural effusion of tuberculous etiology. These have made a cast of the left hemithorax in its lower part. This has resulted in relatively smaller left hemithorax. Please observe that this is relatively smaller left hemithorax as compared to the right one. These are the sequelae of the previous tuberculous pleural effusion. Slightly enlarged lymph nodes are present in right hilar region. The maximum transverse diameter was approximately 1.2 centimeters along its short axis. So it's a malignant growth of right upper lobe which has infiltrated mediastinum. Now I will show you the lung window details. This is the HRCT reconstruction. Now please observe these emphysematous bullae. Centrilobular emphysema is present in both the lungs. Involvement of upper lobes is relatively more severe as compared to the lower lobes. Now please observe these linear irregular thickenings of the interlobular septa in right upper lobe. These are suggestive of lymphangitis, carcinomatosis. These are irregular nodular thickenings of the interlobular septi in the right upper lobe. These are suggestive of the lymphangitis, carcinomatosis. No pulmonary metastases were present. Moderate osteoporosis is noted. There is moderate degenerative spondylosis. Partial compressions of the vertebral bodies are present because of the osteoporosis. Dorsal kyphotic curve is exaggerated. Now please observe this nodular lesion in the upper part of right lobe of liver, this one here. I will show you on the. This is the metastatic lesion here, this one. This shows enhancement upon by the contrast medium. So this was a metastatic lesion. So it makes it T3, N1 and M1 growth of right upper lobe of lung.